Looking for facial treatment that tightens and brightens and doesn't require much downtime. I am 45 and would like to find a facial treatment that does not require much downtime, that I could do more often as maintenance, and will provide tightening and brightening to my skin. I have had Fraxel in the past, with minimal improvement. I also did 3 Dermapin treatments last year, which were good but somewhat painful. Just wondering what else is out there. Thank you.
Thank you for your question. You state in your question that you're 45 years old and you're looking for something that will tighten and brighten and not require much downtime. And you have experience already with some Fraxel treatment as well as 3 Dermapen treatments. And you described the Fraxel treatment as not being that effective and the Dermapen treatments as being more having some painful associated with it. And so you're looking for options and strategies. Now, of course, in the absence of physical examination or photo, I can give you some general guidance as to how I counsel my patients who have the exact same question every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with their skin is something has been part of my practice since the very beginning. And even as a cosmetic surgeon who offers a wide range of surgical solutions for facial aging, everything from eyelid surgery and helping people with puffy under eye bags and facelifts, it's very important to still also address skin issues. So within our practice, we do everything from non-surgical solutions, whether it's skin products, to minimally invasive procedures, to lasers, and various types of injectables. And so I've had the opportunity to deal with this issue, and fortunately we have more options, and I can tell you what sounds like an option that I would offer to someone like yourself who has this type of situation. So before doing that, it is important to understand some of the science behind what is a challenge at the age of 45. And when people think of tightening their skin, it's because they naturally feel that the skin gets loose with age. To a degree, that's right. However, I would also ask you to consider the different elements of facial aging that are relevant in your 40s and beyond. And what I'm speaking about is basically the foundational loss of bone and soft tissue. And so as you get older, you lose bone. And so when you do, then the skin kind of becomes a little more loose. People keep finding ways to try to tighten the skin. But there's a distinction there. You can tighten up to a certain amount, but when you look at the underlying issue, you might find an opportunity that could also help you in this desire to improve your appearance. There's a strategy we call structural volumizing. And with structural volumizing, for example, in the cheek and the chin, the jawline area, I'm actually placing a long-lasting filler, such as Juvederm Ultra Plus or Juvederm Voluma, at the bone level, between the bone and the muscles, and it restores volume in a way that actually helps people's skin appear tighter and look more balanced and more harmonious. We've done this for patients who have acne scars, who tried with time and time again with different modalities to help their scars, not appreciating the doctors previously that a little bit of volume at the cheek level, at the bone level, actually can have a significant impact. Now, to go specifically into the non-surgical approaches, which are not so painful and require minimum downtime. Well, one strategy we use involves lasers, such as the Q-switch laser for collagen remodeling, which can have some tightening but as well as improvement of skin texture and quality, something you may have tried to accomplish with limited effectiveness with the Fraxel. There's also a treatment that we use with a long pulse erbium YAG laser, which actually generates more heat into the skin and causes shrinking and tightening. You can also consider a radiofrequency such as Pelave, where there is no downtime because the skin is left fully intact. And all of these treatments I'm actually describing all leave the skin intact. And last but not least, but I think is also a significant advance in the treatment of skin, is that when you think about the skin becoming thinner and more loose, there is a decrease in, of course, something everyone knows about, collagen. But there's also a decrease in blood supply and fat. So we actually use this device, which it looks like a microneedling device, but it actually delivers anything you want at the level of skin with no bleeding and is not painful at all. And so what we're doing essentially is, for patients like yourself, is we'll combine platelet-rich plasma derived from your own blood to stimulate the collagen and improve the skin quality with hyaluronic acid fillers such as Restylane or Juvederm, and placing it into the same device and delivering it in a way that basically there is essentially no downtime. Maybe there's a slight bit of redness, but we're able to really deliver into the upper levels of the dermis this great combination of materials. So when you think about it, we have solutions that are laser or light-based, as well as radiofrequency, and solutions which can deliver something therapeutically without downtime. So therefore, it is the kind of strategy that our patients are more and more gravitating towards. And it's a trend that I recognized since the early 90s, where patients simply don't want downtime and don't want to have, and want to be able to do skin maintenance with minimal downtime. And so I think that a lot of the technology has improved, but it's not a single solution approach, but rather a synergistic, multiple solution approach that I customize for every patient. So I think that this is worthwhile considering for yourself and thinking about whether or not this is sustainable for you. I always teach my patients that skin management requires a commitment like exercise or diet. You want to do things with some regularity so that you can maximize your appearance for the long term, instead of trying to do something that's a one-off and then not to have to do anything after that. That's just not the way the physiology of skin works. So consider these options and find a doctor that you can have a discussion with about these treatment options and see if any of these work for you. I hope that was helpful. I wish you the best of luck. Thank you for your question.